Good afternoon, Dana. Good afternoon, everyone. We hope that you're having a good summer, and we hope that you have all stayed safe and dry during those wet days that we've had in the past couple of weeks. This afternoon, Bob, Riney, and I will be providing you with some updates regarding COVID, including our vaccine requirement for our workforce. While our hospitalization rate continues to be the lowest for the past, compared to what we've seen in the past 18 months, we are definitely keeping an eye and concerned about what we are seeing around the nation with respect to the highly contagious Delta variant. A study in the journal Lancet last month have found that people who are unvaccinated and infected with the Delta variant have twice the likelihood of being hospitalized. So this means that the people who are unvaccinated tend to have a more serious infection when they are exposed to the Delta variant. And this is something that we are definitely watching very closely. With respect to our COVID numbers, our COVID hospitalizations as of this morning are 28 in all our 5 hospitals. So this is definitely much better than we have seen during the peak of our hospital admissions. But this is also an increase compared to what we have seen a couple of months ago. In fact, for many weeks, our numbers were running in the teens to at most 20, and now we are starting to see a slight creep up of the numbers. Our test positivity rate for COVID is 3.6% this morning. We've been running more along the 1 to 2% for many weeks in a row, and now we are starting to see numbers in the mid 2, and this morning 3.6%. As you have heard, nationally, the numbers are continuing to increase. So there has been a 198% increase of COVID cases, new cases in the past 2 weeks, and the number of deaths is also increasing. What is most important, that 97% of the people being hospitalized at the present time are unvaccinated. So this means that vaccine has provided significant protection for people who have got the vaccine, and the hit is the present time seen among the people who have been unvaccinated. As importantly is that 99.5% of people dying from COVID at the present time are unvaccinated, again providing definite data and science that vaccines protect people from dying. We've seen similar trends in our hospitals. At least 95% of people hospitalized with COVID in Henry Ford Health System hospitals are unvaccinated. So the number of vaccinated people who are getting infected and vaccinated is very, very small. And if we look at Henry Ford Hospital in Detroit, for example, not a single patient who has been fully vaccinated has been hospitalized in our ICU. All our ICU COVID patients are patients who have not received the vaccine. As far as our internal vaccination rate, we are just over 70% of our team members who have received at least the first dose of the vaccine. This is an increase by 2% in the past 2 to 3 weeks since we've announced that we'll be mandating the vaccine. We do expect to see these numbers increase over the next few weeks and through August as we are approaching the September date. When we look at vaccination rate by the different job description and job categories, physicians and leadership are among the highest number have the highest vaccination rate. Our physicians exceed 90%, so does our leadership group. This matches the national trend recently shared by the American Medical Association, where over 95% of physicians around the nation have received the vaccine. Looking at what we know regarding the data, we have over 350 million doses of vaccines that have been administered in the United States alone. And this is including COVID, this includes Pfizer, Moderna, and Johnson & Johnson. The science continues to show the safety and effectiveness of these vaccines. Last week, the Society of Healthcare Epidemiology of America led a consortium of medical societies recommending that vaccine requirement is the best way to provide safety to our community, to our patients. Not only are the COVID vaccines highly effective in preventing infection, hospitalization, and death, but their safety profile is similar to existing FDA-approved vaccines we are already using. So people are concerned about the data. We have plenty of data at the present time related to the FDA vaccine from what we know compared to other vaccines. The Association of American Medical College also came up with a statement at the end of last week, again strongly urging academic medical center and medical colleges to require their workforce to be vaccinated, with the goal to protect them, to protect the patients we take care of, and to protect the community as well as their co-workers who might not be able to vaccinate, might not have been able to vaccinate it because of medical illnesses or because they have some immune compromise that does not allow them to be vaccinated or does not provide them, or the vaccine does not provide them with the immunity that we want to. So there is, at the present time, plenty of science and evidence supporting the efficacy and safety of the vaccine. And we are pleased to see the numbers of people vaccinated continue to increase, although we hope we see a more rapid increase to meeting what is referred to as herd immunity or community immunity that will protect all of us. Now I'm going to turn it over to Bob. Bob?
Good afternoon, everybody. It's good to be with all of you again. When we made our vaccine mandate announcement on June 29th, we did expect that our decision would be met with the same opposition that's been experienced by other health systems. However, the opposition has been largely eclipsed by the widespread support and feedback that we have received from team members, from our patients, and from the communities that we serve, and it's been really gratifying. We are particularly heartened by a note from one of our doctors who likened our decision to the phrase he first heard in medical school, do no harm, as in do no harm by ensuring that we won't pass this devastating virus to each other or to anyone who visits one of our facilities. There's no higher calling. The protests we saw last weekend were not unexpected, given what we've seen in other parts of the country. We are aware that additional protests may take place at other health systems who have either recently announced mandates or are considering them. As we have said previously, we respect the rights of our team members and our community members to express their views. While some of our team members did participate in Saturday's event, and we do not have the exact numbers on involvement, we have strong belief and know that the organizers were not affiliated with Henry Ford, and the majority of the people gathered were not our team members. That said, we're very appreciative that those that chose to protest did so in a very peaceful and orderly fashion. We have never been more committed that our decision to require vaccination is the right thing to do for the health and safety of our patients, our workforce, and the communities we serve. If healthcare is not going to lead on this issue, who will? They depend on us and trust us to ensure a safe and healthy environment, and we pledge to honor that promise. Since our vaccine announcement, 20 other hospitals or health systems across the country have announced that they too are requiring the COVID vaccination for their employees. And we expect that number will grow substantially with the expectation that the FDA will grant permanent approval to the vaccines very soon. Currently, there are 41 hospitals or health systems that have announced vaccine requirements for their employees. And as Dr. Munkarah referenced, it's also been noted that hundreds of colleges and universities are requiring their students to be fully vaccinated before returning to campus in the fall. For our team members who have declined or delayed being vaccinated, we are committed to helping them build trust in the science and the efficacy of the vaccine by being transparent and answering any questions that they may have. And we are doing listening sessions that have been very, very productive at helping our employees understand the why and get any myths out of the way. We want them to feel that they have all the information that they need to make an informed decision. We're also committed to working alongside every team member that has additional questions in any way that they would like to share those questions. We really remain hopeful and optimistic that we'll navigate this together and that we don't lose any of our valued team members because of this decision. As we all know, we are now 16 plus months into this pandemic, and all of us are clamoring for this to come to an end. We can end this by getting vaccinated. Rely on trust and trust sources that are the right sources as you gather information. Your doctor, your faith leader, or a loved one who has been vaccinated. Rely on information that's grounded in facts and be very wary of misinformation or disinformation that's being spread on social media and the internet. The math is the math. We see where we have high vaccination rates, we're keeping the virus and its new variants at bay. And where we have lower vaccination rates, we're seeing slow but concerning trends once again. And in other parts of the country, some significant trends gaining. We need everyone in this fight. And for vaccinations to make a deep and lasting impact on the pandemic, we need our rates as high as they can possibly be. Safety and infection prevention is all of our responsibilities. And as hopefully this community's trusted healthcare leader and voice, we have a responsibility to lead by example, instilling confidence in our communities by stepping up, being vaccinated, and then educating our friends, our families, our coworkers, and our neighbors about the safety and effectiveness of vaccines. With that, Dr. Munkarah and I are happy to take your questions.
Thank you, Bob, and thank you, Adnan. And folks, if you want to go ahead and leave me a message in the chat or raise your hand virtually, I'll go ahead and call on you in order in which I see your question to the best of my ability. So I have Justin Hicks first from MLive, and after that, Kim Craig, I'm coming to you, and then Marie. Justin, you can go ahead and open your microphone and ask your question.
Yeah, thank you. I appreciate that. My question is for Dr. Munkarah. Michigan is faring well in terms of case rates and hospitalizations in recent weeks compared to other states and hotspots around the country. Is there anything you're seeing different here in Michigan versus some of those spots? And what level of concern should Michiganders have that we might follow suit with some of those other states?
Thank you, Justin. I agree with you that so far, keeping our fingers crossed, our numbers, we seem to be faring better than what the rest of the states are seeing. Although if you start tracking the numbers over the past few days, we are starting to see an early uptick. And we definitely hope that this is not the sign that we are starting to see a spread of the Delta variant into some of our communities where the vaccination rate is lower. The good thing that in Michigan, we've done well, relatively well with respect to our vaccination rate, and we hope that we'll continue to increase those numbers to a point where we have better protection across the whole state and not only across certain areas or certain regions. What's extremely important, Justin, is there are two things that I want to bring up. There is more and more evidence at the present time that the current vaccines do have efficacy against the Delta variant. There is now 2 or 3 very good papers in journals like Nature and Science that have shown that the current vaccines that we have do protect individuals from the Delta variant. So this is very important point for us to remember and to kind of make sure that we keep it in mind as we make our decisions. And this is why we are really encouraging people to get vaccinated. The other thing that is extremely important is the question regarding, does infection provide natural immunity? And the data shows, yes, it does. However, there is also some recent evidence at the present time that a prior infection provides natural immunity that might not be as effective as the vaccine. So the Delta variant seemed to have a way to escape natural immunity from prior infection. And when you add the vaccine, at least 1 dose of vaccine to a prior infection, it boosts the immunity so that the body is able to kind of fight these variants that we are seeing at the present time. So these are important things for us to learn from. This is emerging data that is important for us to say, even if somebody has had an infection, it's important to get vaccinated to boost the immunity. And number 2, despite the concern about the Delta variant, the vaccines do work.
Thank you, Dr. Munkarah. Next on my list is Kim Craig, WXYZ. Kim, go ahead and ask your question.
Hi, yes, thank you, folks. Wanted to find out, so if you just stay at 70% and don't get much more many more employees vaccinated, are you looking at the possibility that you could lose 20 to 30% of your workforce? And how are you preparing for the possibility that that may happen? And in what areas are the least vaccinated members of your team? Are they in the medical staff? Are they clerical? If you can say if there's any sort of way you can determine that.
Yeah, thank you, Kim. I'll take that question. First of all, we know from the reaction we're getting through the employee listening sessions and the scheduling that's starting to take place that employees are increasingly getting scheduled for the vaccination. So we do not believe that we will be faced with significant numbers by September 10th, by the time that deadline rolls around. And our job is to make sure that number is as small as we can possibly get it. Ideally, we'd like it to be zero, but we know that that's probably not likely. But we don't anticipate the huge numbers at the end of the day based on the conversations that we are having with our team members. To answer the second part of your question, it's really two groups. The first group is some of the entry-level populations in housekeeping, dietary, and things like that. And we're working very specifically at understanding what their fears are, what additional information they need, and how we can help them navigate through the decision-making. And the second group, which is a fairly large group, is the thousands of people that have been working remotely since the pandemic began. And they have indicated in great numbers that as they return to the workplace, and we are now in the process of doing that, that they will get vaccinated. They were not vaccinated when they were basically secluding and working remotely. So those two populations are the biggest gaps that we have to fill. Expecting, though, that we could possibly have some team members that will opt to leave, we have put in place and are continuing to develop mitigation strategies to make sure that we have the right staffing so that there would be no gap or no hiccup in care or experience whatsoever.
Thank you very much, Bob. Next on my list is Marie Osborne with WJR. Then I have Chris Hall and Sandra McNeil.
Good afternoon to both of you. I have a quick question that sort of piggybacks off of Kim Craig's question, and that is that we have found statewide and nationally that the level of vaccination, that needle is getting harder and harder to move as the numbers of vaccinated people increase. So yours stands right now, you're saying at about 70% with your staff and your employees. What specifically, aside from listening sessions, are you going to be doing to try to get people to come to the other side to get those vaccines done?
You know, there's a whole multitude of communication vehicles that we're deploying, some of which are internal to our organization, as I just indicated. Some of it is a coalition alliance with faith leaders who have stepped up to engage with parishioners or members of their congregations who also happen to work in healthcare. And we're also looking at a spokesperson that can relate to someone's individual fear. So if someone's fear is a historic trust and a belief that their particular race or gender has not been treated appropriately through medical research historically, and they have some just, you know, beliefs that have been transferred across family or across generations. We're having individuals that are from that same group that are really talking about their own discernment, their own journey, and how they concluded that vaccine was the right way to go. So there's not one strategy, there's a whole host of strategies. We're trying to make it very personal. And we're also using a lot of facts and helping people understand that this isn't just about us as individuals, it's about our contribution to ensuring safe and healthy workplaces and safe and healthy families. Dr. Munkarah, did you want to add?
The only thing, Bob, I would add is that we've been at this now for a number of months. So all the measures that Bob has mentioned, that we have also established fun events, we've done vaccine campaigns, we've established incentives, we've done one-on-one sessions in that respect, and we'll continue to do everything possible to kind of make sure that we move the needle on that. What's clear that, to your point, we've got to a point now that we are concerned about the low vaccination rate, especially as we are approaching the fall, as we are approaching the influenza season, and as we are expecting that children will be going back to school. And this will present a significant concern with respect to the dates and the need for us to move that needle faster.
Bob and Dr. Munkarah, if I may, because at this point we're seeing it be a very personal conversation that's moving the needle, be it with somebody's family member, somebody who identifies as Bob mentioned, possibly your physician, your primary care physician. I'm curious, what kind of conversations have you each personally had in terms of vaccination, maybe with your friend circle or your family circle, especially considering your unique perspectives?
Yeah, I can start by, I appreciate that question, and I can start by saying that my conversation with some family members and friends that were hesitant to get the vaccination, it was oftentimes about younger people saying, I know, but if I get it, the chances that I'm going to die from it are small. And I remember hearing enough about that it told me that we are doing a disservice if the only thing we put out there in the public or focus on is the death rate. Because the death rate is obviously very, very important, and we should do everything we can to make sure that no one dies from COVID. But what's lost in that conversation is the lasting impacts that many people are feeling who contract COVID, survive COVID, but then have lingering impacts that affect all sorts of their quality of life. And it's one of the reasons we have 2 clinics at Henry Ford that are really designed to deal with patients that are having ongoing, lingering, and serious impacts from contracting COVID. So we needed to broaden what they need to be worried about beyond just a mortality rate, but a quality of life rate. And then the second point I would make is reminding them that our responsibility is not just if we feel healthy and we feel we have a good immune system, but it's to stop being able to transmit this virus and pass it on to others that may not have the fortune of the immune system that we have. And so it's about being selfless at a time that a pandemic, a virus, doesn't care who you are as long as you can be a host to pass it on. And that's a responsibility. So those have been, some of the personal conversations I've had.
A couple of things, Dana, that from my perspective we look at is number one is to listen to the concerns and understand where their concerns are stemming from. If there are concerns regarding the safety or the efficacy of these vaccines, try to kind of share with people numbers and data in that respect. The reality, this is not the flu. And as Bob has mentioned, this is a disease that has really affected and devastated our community. We have hundreds of thousands of people who have died of COVID. There are tens of millions of people who have been infected with the disease. And this virus continues to show us that every single time we think that we have it under control, it has a way to escape that. And it has shown, the data has shown us now that our way out, our best way out and only way out is vaccination now. As we shared in our briefing, is that the vaccination has allowed us to prevent people from getting into the hospitals. And to Bob's point, in healthcare, our obligation is to the patients and the communities we serve. There are patients who are cancer patients that we take care of. There are patients who have heart disease, who have lung disease, who come to see us. And if we are the vehicle to kind of transmit the virus to these people and these people end up dying, we really are not living up to our mission and to our values. We are here to protect our patients and to protect our community. The other thing that we want also to keep in mind is that this is not a virus that spares the young. Currently, the median age of the people who are being hospitalized and getting into the intensive care units are not people who are in their 50s and 60s. These are people who are now in their 30s and 40s. So this virus is showing us that it can affect and impact people who are younger. We have hundreds of children who have lost their lives to COVID. Yes, it is not thousands, but it is still hundreds of lives who have been lost that could have been saved. And children at the present time do not have the privilege of being vaccinated. We don't have the data on children who are under age 12. So these people, these young children, these young lives, we are exposing them to the risk of the vaccine if we don't take that measure ourselves and we vaccinate people. And then, to many of us, we role model and we show our beliefs in these. My whole family is vaccinated, including my children. My teenage nieces are vaccinated. My whole brother's family is vaccinated. So we really show that we believe in the data that is out there, and we advise and recommend to our loved ones and our closest family members to get the vaccines, because we believe this is the way to protect them and to protect our communities.
Thank you, Dr. Uncle Adnan. I appreciate that. And thank you all for indulging me. I know you're all on deadline, so I'll get back to my list. Chris Hall, Free Press, you have a question. And then I have Sandra and then Karen Bouffard if you have a follow-up.
Yes, thank you. I was just wondering, with the protests from the weekend, is there any inclination to change the date for the vaccine requirement of employees? And can you just be specific on when they need their first vaccine or when they need to be fully vaccinated, if that September deadline is for full vaccination? And I think you addressed the other part of my question about how will you handle it if you lose 20% of your workforce. So my main question is, have the dates changed, and what do they need absolutely by that September deadline?
Yeah, thank you, Chris. We have not changed the dates, and it is fully vaccinated by September 10th. And we are making sure that access to vaccinations is not a problem in any way, shape, or form. And the reason that date is important, it's not an arbitrary date. It's to Dr. Munkarah's earlier point, is that, we're heading into what will likely be the start of an influenza season. And in September, we will head back into more indoor activities and outdoor activities. And this is where we are at greatest risk for a proliferation of both the influenza and COVID. And so we want to make sure that we are ensuring a completely safe, or as safe as we can possibly make it, environment before those two elements happen.
Thank you, Bob. Sandra McNeil, WWJ.
Can you hear me? There we go.
We can hear you.
I would just want to make sure then, so the people who are not vaccinated will be fired on September 10th. Is that accurate?
We have set that deadline, and you need to be vaccinated to remain an employee, yes.
So there won't be any grace period at the time or anything like that?
There might be special circumstances that we would always consider. I mean, there's people that, end up on leaves. There's all sorts of things that might get in the way. So we would certainly be very responsible to dealing with any kind of special considerations, but those will be the exception, not the norm.
And I did want to ask you, you talked about the vaccines are working, but there have been reports that the J&J is not as effective against the Delta variant. Are you seeing that in any of your hospitalizations?
We have not seen any of these, Sandra, and I agree with you. The data that we are aware of that I've mentioned in these journals have looked at Moderna and Pfizer in that respect. But to your question, we've not seen any Johnson & Johnson vaccinated patients who are in our intensive care units.
Thank you.
Thank you. Karen Bouffard, did you have a follow-up to the question that I answered in the chat?
Yes, hi, thanks. It was mentioned that you don't believe that all of the people who were protesting were from, actually from Henry Ford Health System. Where do you think those outside agitators came from?
I didn't call them agitators. I just called them individuals that didn't work with Henry Ford Health System, because they were very peaceful protests. But, I've gotten a number of emails from individuals that were in the community that had indicated that they were going to protest on just a belief around, individual rights or other issues that were near and dear to them, that were not employees, and they indicated they didn't have any family members that were employees. So I can't speak to where they came from. I can just tell you that, from all of the review, it looks like there was a lot of individuals that were there supporting what they believe was a cause, not actual employees.
are you thinking that these were people that were just against vaccinations in general?
You know, it was, we certainly had individuals that had expressed that they're against vaccinations. We had individuals that wanted to use the opportunity to exercise their beliefs in open carry. We had all sorts of responses from various individuals or groups that some related to vaccinations, some unrelated. So I can't speak to who actually shown. I can just say that whoever did show up was respectful and peaceful, and we were very appreciative of that.
Thank you.
Thank you. And we have one last person on my list, and that's Kim Craig with a follow-up. Folks, we're going to have to start wrapping things up, but if you do have any more questions, please raise your hand or send me a message. And with that, Kim, go ahead and ask your question.
Hi, yeah, folks. So state health officials might say they would love to be at 70% as a vaccination rate here in Michigan. And I'm wondering if, critics might say that Henry Ford has enough vaccinated people if you're at 70% now. Is that really an accurate comparison for some sort of herd immunity among your workers here?
But I'm sure Dr. Munkarah will have something to add. But what I would say, Kim, is that if this was a non-healthcare business and we had 70% vaccination rates, I think we would feel comfortable that we were a big part of the solution. But, our customers are vulnerable patients, and we have to ensure that we are not doing anything that would allow this virus to be transferred from one individual to another. So I think healthcare does and should be held to a much higher standard in this regard. Dr. Munkarah?
I agree with you, Bob. And this is, if we look at examples when we, and most healthcare systems around the nation decided to mandate the flu, it's exactly related to the same point, is that we have a vulnerable population who are at a higher risk, and we cannot be comfortable with the vaccination rate that exists in our communities because of the exposure that our patients have. So this is where we need to kind of make sure that we have a higher vaccination rate among our healthcare workers to protect the vulnerable population that we have.
Thank you both.
I might add that, one of the calls I first got was from a patient, and the patient was having a procedure in the fall, and their first reaction was, "I'm really glad you're doing this. I had assumed that everyone that I would come into contact with when I come in for my procedure would be fully vaccinated. I had assumed that to be true, and I'm so glad you're taking this action." I think it's an important point because I think the public expects that we are doing everything to ensure their safety and not settling at numbers that leave that short.
And Bob, I would add to that I have many patients who express to me personally that they do not want to be taken care of by staff who have not been vaccinated. They are very concerned about the risk to them, and they want to make sure that it is vaccinated healthcare personnel who are taking care of them and rendering care to them.
That's incredibly poignant. Thank you so much for those anecdotes. Dr. Munkarah, can you address a little bit more how the vaccines rendered the flu season rather minuscule, if you will?
I'm sorry, can you repeat your question?
Yeah, can you talk a little bit about how the flu vaccine helped to mediate, some of those issues for us?
Oh, absolutely, Dana. So there is no question that the use of flu vaccine has helped us decrease the number of deaths and hospitalization from the flu. And if you think about it, in fact, the flu vaccine is nowhere as effective as the COVID vaccines that we have now. Depending on the year, the flu vaccine efficacy might vary anything between 50 and 60%. And we used to feel comfortable with that. We have vaccines that are at the present time 90+% effective in preventing the infection or minimizing its impact. So much more effective vaccine. The other thing we need to remember also, last year when we were in the midst of a COVID surges, we made every attempt and made sure that we have a high vaccination rate among our staff. And what we have seen is that the flu rates in the community, because of isolation, because of masking, because of hygiene, and because of the vaccination, helped us really mitigate the potential risk of having a high hospitalization for both flu and COVID at that time, which would have been devastating. And this is what we want to avoid now in coming into this fall, especially with the Delta variant. Imagine the disaster that might happen if we have a Delta variant that is rampant, and then we have a flu season that start claiming many lives at the same time.
That makes me think of an anecdote I heard about people who are getting COVID, even though they've been vaccinated. And that anecdote, that person said, well, you know, linebackers wear helmets. It doesn't keep them from getting injured, but imagine if they weren't wearing helmets, right? So I thought that was both comical, but also useful. Gentlemen, our last question is a follow-up from Chris Hall at the Free Press. Chris, go ahead.
Thanks. Yeah, I was just wondering if you've heard of any other health systems here in Michigan that is requiring employee vaccines aside from Henry Ford and Trinity Health?
Chris, we haven't heard directly, although the Michigan Hospital Association is continuing to gather where other health systems are at relative to vaccination rates and compliance. So I can't speak to any I've specifically heard. I would just tell you that I personally believe that there are many other health systems that will take the same or very similar action because their commitments to safety are strong.
Thank you.
Thank you, Bob. Folks, we're going to go ahead and wrap it up. Bob and Adnan, anything you want to add before I let these fine folks go about their day?
Well, I want to thank everyone who has been with us, who have been asking the questions. And our plea to you, please share information. Please spread what we know about the vaccine, about their safety, because this is data, this is science, this is not politics, this is nothing, this is not an opinion. We have data that drives us. The decision for vaccination is a medical decision. It is not a political decision. It is not a freedom decision. And this is all what we ask for, is to kind of make sure that we take that discussion to where it needs to be, the health of our community.
Yeah, we're counting on people to do the right thing. That many have already done so, and we think that others will do the same. We're facing something we've never faced before, and this is a time for unity. The virus will not win if we're unified.
Thank you so much. Thanks everybody for joining us this afternoon. Bob and Adnan, thank you so much for your time. And as ever, thank you for your leadership. I truly appreciate you. Everybody have a great afternoon.
Thank you.
Thank you.
Thank you.
Thank you.